Welcome to the Road to Independence, a guide to ostomy teaching. This is a helpful guide for you to follow as you learn how to care for your new ostomy. By the end of this presentation, you will be able to understand the function of different ostomy supplies, change an ostomy appliance, and recognize normal versus abnormal characteristics of an ostomy, and understand care after discharge. So where do we begin? First, take a deep breath. The task of caring for a new ostomy can be very overwhelming, but you will begin to realize that the process is very simple and that you can do it. Let's get started. First, let's gather some supplies. You will need your ostomy appliance, stoma adhesive paste, barrier wipes, measuring card, including a pen and some scissors, towels or face cloths, and stoma adhesive powder. Before we start anything, let's talk about these supplies you have in front of you. The first and most important thing is the ostomy appliance, or pouch, as it is sometimes called. The ostomy appliance will collect the poop that comes out from the stoma. There are two types, a one-piece and a two-piece appliance. Most pouches have a built-in closure like Velcro to close your bag. Both types of appliances come in clear, see-through, or opaque, not see-through. The one-piece appliance involves a pouch and a wafer that are already together in one piece. The one-piece appliance is more flexible than the two-piece appliance. The two-piece appliance involves a pouch and a wafer that click together like Tupperware. Spouted pouches can be used for urinary-type stomas or for stomas that have high-volume stool output that is loose. This pouch has a different closure device. They can be connected to a special drainage bag that can drain urine or stool overnight or can be secured to your leg with a strap during the day. Here are a few more key points when talking about supplies. While in the hospital, a clear pouch is used so that your nurse can see your stoma. The type of appliance used, one-piece or two-piece, depends on the type of ostomy and the individual patient situation and patient preference. Stomas and bellies come in all shapes and sizes, and there are all different types of appliances to adapt to these differences. Your nurse will help you find the right appliance for you. At the time of discharge, a one-piece opaque appliance is used for most patients. In order to keep the skin surrounding the stoma protected, there are a few things to use. Barrier wipes will help by forming a clear, protective film over the skin to help prevent irritation. If irritation does occur, stoma adhesive powder is used with the barrier wipe, but we'll get into that later. Stoma adhesive paste is used to prevent leaking, almost like caulking around your bathtub. You apply it around the stoma opening cut in the pouch to prevent leaking. It is also used to fill in bumpy, uneven skin surfaces to prevent gaps between the skin and the ostomy appliance wafer. The Ekin ring is a donut-shaped, sticky, gum-like material used in place of paste to prevent leaking. You place it around the stoma before the pouch is put on the skin. You will need a few other supplies for the pouch change. Make sure you have a pen, scissors, and a measuring card available. The measuring card has many different size circles that will help you measure your stoma so that you can cut the appliance to the right size. Gather towels or face cloths for the pouch change. These help with cleansing the skin surrounding the stoma. They also help clean up any poop that might come out of the stoma during the appliance change. Now that you're familiar with the types of supplies you will be using, you are ready to change your ostomy pouch. Remember, this takes some practice and your nurse will be there to guide you. It is helpful to use the home care instructions for changing an ostomy pouch for guidance during your bag change. Now for the interactive portion of the presentation. Several slides for the remainder of the presentation will have short videos for demonstration. Now, we will walk you through the steps of a pouch change. With one hand supporting the skin and the other hand lifting the wafer, gently remove the wafer from the skin. Once the wafer is removed, wash the skin around the stoma with warm water. Do not use soap. When soap is not rinsed off well enough, it becomes difficult for the wafer to stick to the skin. It is important to know that when washing the skin, a small amount of bleeding from the stoma is normal. Now, take a minute to watch the video clip. Here's a helpful tip. Always dry your skin well before putting on your new pouching system. Do not use moistened wipes or baby wipes that contain lanolin or other oils. These can prevent your pouch from sticking to the skin. Now take a minute and look at your stoma. The stoma should be pink or red in color and moist. It is very unlikely, but if the stoma is purple, black, or blue, you must call the doctor immediately. This change in color is considered a medical emergency, as there may be a blockage or a problem with the blood flow to the stoma. Take a look at the skin surrounding your stoma. Stoma output can be very irritating to the skin. If there is no skin irritation, wipe the skin surrounding the stoma with a barrier wipe to leave a protective layer on the skin. If there is skin irritation, first apply a small amount of protective powder to the open, red, weepy skin, and then lightly pat the powder with a barrier wipe. This helps to seal the powder and to help dry and heal the areas of skin irritation. Let the barrier dry for 1 to 2 minutes. If the area of irritated skin does not improve after 3 to 4 pouch changes, the irritation may be a candidal rash. A candidal rash often has a prickly or spotty-like appearance. The skin may be also itchy. In this case, stop using the protective powder and switch to the prescription antifungal powder. You will get this prescription at the time of discharge. Apply a light dusting of antifungal powder only to the areas where you see the rash, much like you saw with the protective powder in the previous slide. Then seal it with a protective barrier wipe. Please take a look at how a candidal rash may look on a dark-skinned patient. Note the improvement 3 days after starting the antifungal powder. Skin folds or scars can make it challenging for a pouch to stick onto the abdominal surface and cause pouches to leak and result in skin irritation due to poop sitting on the skin under the wafer. If you have a challenging pouch, your nurse will work with you to find the right pouching system. It is helpful to hold the skin flat and smooth when you put on the pouch to avoid wrinkles that may lead to your pouch leaking, causing skin irritation. Now that the skin is prepared, measure the stoma with a measuring card, finding the right circle on the measuring card that fits closest to the stoma without touching it. Remember, as swelling goes down, the stoma may change in size or shape during the first 3 to 4 weeks after surgery. Once you find the right circle, trace that circle onto the paper on the back of the wafer. Remember that the stoma may not be a perfect circle. Before you cut, push your finger through the hole of the wafer, separating the bag from it so that the bag does not get punctured by the scissors. After cutting, run your finger along the inner aspect of the circle to smooth out any rough edges. If you are using a two-piece appliance, attach the pouch to the plastic ring on the wafer. Next, peel the paper off the back of the wafer. Apply Stoma adhesive paste around the opening on the sticky side of the wafer. Squeeze the paste to the thickness that you would squeeze toothpaste onto a toothbrush. Okay, so we realize that some people use more toothpaste than others. So what is the right amount? Take a look at the Goldilocks rule. The picture on the top left is way too little, the picture on the top is way too much, but the picture in the middle is just right. Let's talk about the pectin ring and Ekin ring some more. If the skin around the stoma becomes irritated, you may need to stop using stoma adhesive paste and use an Ekin seal instead. Mold the skin by using the 2 paper discs it is packaged in and gently stretch the ring to the size of the stoma. It is important not to touch the Ekin seal with your fingers as it will lose its stickiness. Center the pouch around the stoma and place it onto the skin. Firmly press the wafer to the skin and hold for 3 to 4 minutes so that the wafer sticks to the skin. In the hospital, you may hold a warm pack over the stoma to help the appliance stick to the skin. At home, try rubbing your hands together for a minute or so to create heat and then put both hands over the bag to help the appliance stick to the skin. When you're in the hospital, your nurses will position your bag to the side to allow easy access for drainage. When you are able to walk to the bathroom, your bag will be positioned straight down so it will be easy to empty your poop into the toilet. Here's a tip if you are changing your appliance by yourself. Fold the wafer in half and line up the bottom of the hole to the bottom of the stoma. Then fold the rest of the wafer onto your skin. Place the pouch clip on the end of the pouch if applicable. Some pouch systems have a Velcro-like closure at the bottom of the pouch and therefore do not need a clip. After applying the pouch clip or securing the Velcro, be sure to give at least 2 to 3 tugs. To do this, hold the middle part of the bag and gently tug on the end of the pouch to be sure that the clip is closed and secure. Now, let's put it all together. Take a minute to watch a pouch change from start to finish. Congratulations! You have successfully changed your ostomy appliance. You should be very proud of yourself. We expect that as you continue to become independent with caring for your ostomy, you may have some questions. Your nurses are here to answer them, but here are a few frequently asked questions. When should I empty my pouch? Make sure you empty your pouch when it is a third of the way full. From 7 a.m. one morning until 7 a.m. the next morning, you usually empty your pouch about 6 to 7 times per day. This is usually the number of times you urinate, so you can empty your pouch at the same time. If the pouch gets too full, it will become too heavy and pull away from the skin and cause it to leak. To empty the pouch, simply open the clip or release the Velcro and allow the poop to slide out. When you are moving around better after surgery, empty your poop into the toilet. After emptying, you will notice poop to be on the end of the appliance. Simply clean the end with a baby wipe or toilet paper and reapply the clip or Velcro. Do not squirt water up into the pouch as it will loosen the seal and likely result in leakage. When should I change my ostomy appliance? You should change your pouch every 2 to 4 days, typically every 3 days after you leave the hospital as instructed by your nurse. While you're in the hospital, you will change your pouch on the 2nd, 4th, and 6th day after surgery for teaching purposes. You should also change your pouch if there is any leaking present. What supplies are needed at home? Your nurse will work with a unit case manager to contact a medical supply company for ostomy supplies to be delivered to your home and will also set up a visiting nursing agency. The nurse that will discharge you will send you home with extra supplies to get you started. There are a number of medical supply companies that deliver ostomy supplies directly to your home, and the case manager on the unit will set you up with a company that is covered by your health insurance plan. Most insurance plans will cover a predetermined maximum quantity of pouches each month. For example, 15 pouches per month. After the first delivery, you can contact the company directly for additional supplies. Make sure you do this ahead of time so that you do not run out of supplies. The case manager will set you up with a visiting nurse. The visiting nurse is a nurse who will visit you at your home to help review ostomy care and to see how you are doing. The nurse will also help answer any questions you may have as well. Here are a few other helpful tips for you after you go home. Pack a little bag for school or for traveling that contains extra supplies. You should always have a backup pouch with you in the event you need to change your pouch unexpectedly. Pack a small, travel-sized bottle of body spray or room freshener. Spray before emptying your pouch if you are concerned with the odor. Use cotton balls or absorbent gel packs if poop is loose or watery to help soak up the poop so it does not leak under the wafer. Always give your school nurse extra supplies so that you can change your appliance at the school nurse's office if needed. Your nurses will be wearing gloves when they change and empty your ostomy appliance, but you don't have to. Just remember to wash your hands really well before and after. And if you want, you can name your stoma. Here's an example: Stoma Stan. There are certain foods that can cause blockages, decrease or increase odor, produce gas, or thicken or loosen stool. Please refer to the Ostomy Diet Guidelines information sheet for a complete list of foods. Keep in mind that certain foods may affect some people more than others. You will also need to increase the amount of fluids you are drinking to stay well hydrated, especially if you have an ileostomy. When should I call the doctor? You should always call the doctor if there's a fever greater than 101.5, signs of food blockage such as vomiting, crampy abdominal pain, stoma swelling, very little or no stool coming from the stoma for more than 4 hours, bloated belly or belly swelling, large amount of watery stool, usually with a foul odor, nausea or vomiting, not able to eat or drink, and irritability. You should also call the doctor if the stool is foul smelling or bloody, If you have a red, rash, or irritation of the skin around the stoma which does not improve after 2 to 3 days, excessive sleepiness, or any other questions or concerns. If you notice bleeding from the stoma, firmly hold a cool, wet cloth over the area. If it does not stop in 5 minutes, call the doctor. If the stoma is blue, purple, or black in color, this is an emergency. Notify your doctor immediately. Here are some resources that are available to you. Congratulations! You are now one step closer to becoming independent with caring for your ostomy. Thank you for taking the time to learn about your ostomy. Please talk to your nurse about any questions you may have. And remember, the road to independence can be challenging, but with practice, patience, and lots of support, you'll get there.